Today we're going to talk about these lines here that come from the nose and can come all the way down past the mouth. So we've got what we call the nasolabial folds. Now, in aesthetics, we can treat these folds with filler, but it is more important first and foremost to fill the reason for these. And the reason for these is we have fat pads here, we have deep fat pads and we have superficial fat pads, and we have fat pads that run along here, up here and here, and as we age the fat pads start to deflate and descend. So what I mean is they come down like that, and you'll notice that if you have very deep nasolabial folds, if you put your finger there, you can feel a deflation around the ligament that runs down that line. Now, what we want to be doing first is to refill the deflation here in this fat pad, which if it dips in and it's coming down and it's descended down, if we refill, that can give a subtle lift already to the nasolabial fold line there. We can go in and treat those, but firstly we should always try to treat the reason that has become if it's become really noticeable. You will also see this become more enhanced if you lose a lot of weight, if you're very athletic, because obviously we have fat pads in the face. What do we do when we lose weight? We lose fat. So you will see on people when they've lost quite a lot of weight that these will become more visible and more obvious. So what we do first is we treat there, then we can come in and treat here. When these lines come from here to here, these are the labial folds, so what we call the marionettes. There's two different things going on there. We either have the pull of the muscle or we have the indentation from, again, the fat pads that have deflated and descended down. We've got to be very careful when we're using filler that we use it sparingly and in the correct places, because there are different aspects of skin aging going on. So it's not just about fat pads. We also have bone, and bone can reabsorb as we get older, so we lose the density in the bone shrink, so then you've got more space within that area, plus the fat pads deflate and descend with gravity, everything